Welcome. We are live at Startup Health TV. My name is Unity Stoakes. I'm the co-founder and president of Startup Health. It's great to be here with Roberto Ascione from Healthware, CEO of Healthware. How are you, sir?
I'm great. Thank you, Unity. Thanks for having me.
So we are at the Startup Health Festival. It is a new decade, 2020. I feel like I bump into you everywhere but your home, right? We seem to be all over the world in different places together. Maybe let's start with you. Who are you? What do you do? What's Healthware? What's your mission? Let's start with you.
Sure. So, by the way, we met first time in 2009, so that makes like a full decade, which is kind of amazing.
We are getting old. What's going on? I'm trying to remember the first time we met and which place was it?
South by Southwest.
Okay, that's always a good place to meet people.
Yeah, and I think if you remember, was the time that we were discussing, hey, this thing that will come, we'll need a name, and we were discussing maybe it should be digital health.
There we go.
I clearly remember that was a great conversation.
And hey, now there's what, $70 billion that have been invested. I do remember that. There wasn't even a term.
Yeah.
I mean, it's just extraordinary what's been happening.
Yeah.
I mean, you're based in Europe, right?
Yeah.
You've got an extraordinary kind of global lens on what's happening. Obviously, the work you do at Healthware, but also with Frontiers. Let's start by just putting a little perspective on what just happened. I mean, 10 years ago at South by Southwest, but what happened over the last decade, in your view, that was significant?
So how long we have? Like 2 hours? No, it's like.
Well, just give us the headlines. You know?
Yeah,
what
sure.
stands out?
Sure. No, I think first off, it's great to be here again, and I think this is getting better and better, the festival. And, as Healthware, we've been around for 20 years, as you know, like now. And so we basically lived the decade pre-digital health. When we were
You're like a real serial entrepreneur. You've been in this, thick and thin.
Since the inception, since I was studying as a doctor and then, founded Healthware. We went through a couple of stints, we got acquired and demerged, and now we are running this independently. So Healthware really came out of the vision that digital and healthcare at some point had to, something to do together. When I was literally studying as a doctor, anything was analog, which to some extent it still is, kind of, because we are in the making of this transition and transformation. And the idea was, what if we apply what at the time was computer science starting off to medicine? My vision was to have bigger impact, which is something that then, it's very connected to what you guys call moonshots, right, in a way. And so the first 10 years clearly were more about this dream and trying to understand, is this really something there? Are these different disciplines really fit each other? And then, of course, since this past decade, digital kind of started to materialize, and of course, it's incomparable today to with 10 years ago. Now it's something there is a lot more attention on, and there's of course a lot more investments that have been going through. I still feel we are kind of in the beginning of it. I don't think we are nearly done.
But do you feel like there's real progress being made today? I mean, what's your sense of the moment we're in?
Well, I think we are probably towards the end of the foundation. I don't think we are, done with it by any means.
And I think that's what's frustrating to a lot of people is there's all this money that's been investing. It's been years already. Come on, let's move faster. Why can't we see the impact yet? But I think, I always like to use the analogy of, the web, right? Before the web, the internet's there. They had to figure out how to get modems into personal computers, and personal computers that in everybody's home. We're laying the pipes, right?
I think we are onto something that is much bigger than that. At the time of the web pioneers, which is an age that we both kind of lived, it was about kind of connecting information, connecting people. So big problems, but not as big as transforming healthcare, which is a lot more complex and a lot bigger. So I think these first 10 years have started to lay down a foundation, understanding, defining a space, I believe setting up a purpose. So giving to many entrepreneurs in the world, and even executives and policymakers also more recently, the notion that there's an higher purpose in digitalizing healthcare, which is really kind of transforming this for better, to increase access, to lower the cost, I mean, the different things that we now all know. But 10 years ago, we didn't know. It was like a dream and intuition. It was not like a notion. So I think these first 10 years created the notion, the space, the purpose, and give us the objectives. Yes, there's been investments, but compared to the size of 7 trillion industry,
Right, it's 7 to 10 trillion globally,
it's
right?
It's still small.
It's small.
So we need a lot more investment. We need a lot more time to scale these things up. And scale is, of course, important. I think we shouldn't lose, of course, the purpose. We should keep the spirit of the web pioneers that you mentioned. It was, let's transform, let's reimagine what we think, doesn't really work the way we would like to. And I'm thinking back to entertainment, music, and travels,
Right.
All of that. Now we are bringing that vision and that drive to healthcare. I think based on that, and with these strong foundations, now it's time to scale this up, And only scaling this up, we will really achieve the kind of impact.
And when are you talking about the big industry players scaling these innovations up? Are you talking about the emerging upstarts? Are you talking about the whole thing? What frame this for us?
I have a fairly clear idea about that. I don't think it's one or the other.
Mm-hmm.
I think it's all of them in kind of different ways.
Mm-hmm.
The startups are important, will be always important, because we need, in several cases, we need to completely radically innovate. We need to, not just like do marginal innovation.
Let's leapfrog forward.
Yeah, we need to really do that radically, and that can only come from startups. We have seen in all other industries, in healthcare is not different. On the other hand, we need like the super large corporations to scale this up. They have access to instantly all the markets. They know how to create policies around, with policymakers, how to basically pay for these things, where there's reimbursement, where there's other kind of schemes. So they have a role to play, and institutions too, because institutions are important to lay the foundations.
Yeah, one of the themes we focus on here at Startup Health is the power of collaboration.
Sure.
And I think the key is breaking these silos down. How can we get the world's largest brands and global enterprises working with these entrepreneurs, emerging health transformers, as we call these extraordinary superhero innovators? How can we start working together? What do you think it's going to take?
That's the platform, the Startup Health platform is already kind of a great vehicle to that, because it's able to align people, energies, companies around purposes, which you call moonshots, which I think is brilliant. And this since the beginning. The work we are doing at Healthware by supporting Frontiers Health in Europe is another way to do that. It's like that's a platform where all the players, literally, now globally can convene, and you have been there multiple times. That's also kind of mobilizing kind of forces. So power collaboration for sure. This is something that we need physicians, we need nurses, we need all the different stakeholders of healthcare, because it's a lot more complex than the other industries like travel and entertainment. It's literally a multi-stakeholder environment.
So let's talk about, you got such an interesting global perspective here,
Sure.
right? Let's dig into that, because what's the global opportunity? What are you seeing in Europe and around the world specifically that you think we can all be learning from in other parts of the world?
Well, I think the interesting part is that if you look at broadly like Asia, Europe, and the US, the healthcare systems are very different. What I think is not different, though, are the people. People that consume healthcare, right? It's something that I like to say, and that we will all be patient at some point. It is better we remember that from time to time, because that keeps us, kind of probably focused on what really matters, right?
It's health's universal, right?
Exactly.
It's the one thing that impacts every human on
and
Earth.
it's the most important thing, because once you don't have that, you cannot do anything.
Yes.
So I think that's like the common layer. So I think it's a people first approach. we're going to solve real problems that real people have. And those problems might be at different stages, but are kind of common all over the world. Now, what I think is interesting of digital health transformation is that the digital can give us the power to reimagine things in the different contexts, provided we really focus on people's needs. And then at that point, I think the institution, the systems, might be probably rethought based on what digital enables. And I think that's probably the way we should look. So rather than see how we should do differently in the different places, I think we should tackle the problems and understand how we can better solve those problems in the context of the legislation, the systems that in the different continents or countries we have. But understanding that digital is transformative about that too. Look at Germany, the new law there. It's something that basically has been designed.
The Digital Health Act?
It's been designed around the way the startup, process work. And I think that's remarkable, and it's something that when I interact with governments, I'm pushing to say, hey, we should look at that because that's
What do you think
smart.
the impact, explain what the Digital Health Act is, or top line, and what you think the impact might be, or why that's significant.
I think the reason why it's significant is because it provides a platform for the companies to basically thrive and grow. And that's important because if even the most brilliant solution that has an impact, has traction, solves real problems, doesn't have the ability to scale as a company, then it's not sustainable. And at some point, it's not accessible to many more people, which ultimately is what you need in order to improve health outcomes at scale.
Yeah.
So the infrastructure that they provide in that country, which is coming to fruition in the spring, it's really shaping up the market, allows you to understand how you can access, how you can at some point claim reimbursement. So in other words, allows you to plan for the growth and the distribution at scale of the proven solution. Has a great attention on safety, on efficacy. So I think it's great in so many different ways as it's being designed. Now we need to see the implementation and then, of course, what will pan out.
So we only have another minute before we're
Cool.
going to go to a quick break here, but what are you most excited about? What gives you hope for the future? What are you up? It's 2020. We're about to go. I hope to see you at South by Southwest in 2030, and I want to see a big smile on your face. All right. Why?
The reason why you already see that smile now is because having been in since the inception, I can really see the momentum, the difference. For a great team anywhere in the world almost that is onto something as a great idea, has proven initial traction, as some initial clinical validation, now is a lot easier to really, put a startup together and really find support in the community and the ecosystem to thrive. That, I think, is already a big difference. It took us 10 years to get there. I think we'll accelerate more. I think we'll take time as we will kind of transform everything. But I think we are in a great, I would say, place now. Probably the pipes, those kind of foundations, the modems have been probably, kind of deployed. And I also want to really see more the big tech companies, coming into, the equation. Talking the Apples, the Googles, and all of them. I would like to see them part of the ecosystem.
And I just want to remind you, when I see you in 10 years, you're going to have a 10-year-old, not a brand new newborn. So congratulations on that.
Thank you so much.
Just want to thank you for everything that you do, that we've done together. You've been such a good friend to Startup Health. So thank you so much, and look forward to hopefully visiting you in Italy soon.
Yeah, that'd be great.